Good morning. Thank you, Jamie, for your kind invitation. She called and she said, Dr. Groman, I know you can talk for more than 1 hour, but can you keep it to an hour? Because we'd like you to talk at this post-stroke conference at St. Rita's. And please send your PowerPoint over and we'll get it all ready. And I said, Jamie, I've never done a PowerPoint in my life. So I don't know if I'm going to get fired. I'm not shaking in my boots because I'm not wearing boots. I'm shaking in my shoes and a bit nervous too. But with prayer, and I thank prayer starting this conference today. But I am Dr. Darrell Groman, optometrist since 1985. I am Darrell. I do have 2 R's, 2 L's, and 2 I's. D-A-R-R-E-L-L. I have a right eye and a left eye. It's maybe a good dad joke, but it's also a really good optometrist joke. So you did hear that I have 38 years of experience, but if we actually go back in my life to age 7, 60 years of experience with vision care with my first glasses in 2nd grade and contact lenses, the old PMMA, hard contact lenses in 10th grade and gas permeable lenses, but I saw a big difference going from my myopic glasses to putting on contact lenses that opened up my periphery. And I thought, wow. And so there are a number of pieces in my life history that are significant in the care that I offer. I graduated Bluffton High School, went to Ohio State University, 4-year degree zoology. I had to apply 3 times to get into optometry school the first time. I got C's in all the sciences. You're supposed to get A's, maybe a few B's to get into professional school like that. Latin 101, 102, 103, 104, A, beekeeping, A counted in zoology. Brought my grades over a 3.8 to have the lowest grade point average in the optometry entry class in 1978. They gave me a 0.00 grade point average to start with. 3rd year of the 4-year program. I love these $2 bills. I hand them out. I get a weekly supply. After autumn quarter, December 1980, the dean and faculty called me and said, they didn't say it this way, but I'll say it this way. You're 4 pennies short of a $2 bill. You need a C average, 2.00 to keep going. Darrell, you're out of optometry at The Ohio State University. Do not come back. I went to the cracker floor at the Kroger Bakery. Didn't have enough cookie orders in February 1981. I was laid off, lowest point of my life. I'm not a good reader, not a good test taker. I found out to get a little bit more money, I could be a taxi driver, maybe, but I had to take the test. Multiple choice test at City Hall, taxi driver's license, multiple choice. So where's the A, B, C, or D? Where's the street address for Grant Hospital? Where's the street address for the Highlight Restaurant? Where's the street address for the Ohio State University Airport, A, B, C, or D? Where is the street address for the Kahiki Restaurant? I barely passed that test, was a taxi driver for 3 days. Got called back to the Kroger Bakery. I graduated from the Ohio State University College of Optometry in 1985. We'll omit that, but having the privilege to only have 7 years of optometric general education to get through the 4-year optometric course. Thank you, Jesus. So thank you for this kind opportunity for me to be here. for this multidisciplinary approach to the treatment and management for the post-stroke individual. And as I mentioned, this is my first PowerPoint presentation. What do I do here? Flag me down if I'm not turning the page fast enough. So this is my first, not only document. How many of you have your first PowerPoint document? Anyway, this is mine. And my first presentation by PowerPoint. This is a big group to be talking to. But I thank my son for his help putting this together. Dad. Anyway, we won't say what he was saying about what I put together. But also want to thank St. Rita's, Dr. Hicksonbaugh, Todd Hicksonbaugh, Dr. Hicksonbaugh for the emergency appendectomy for Christian a couple years ago. It was the most challenging appendectomy he had because it was up here and up and down, and anyway, it took him a lot longer. So I thank St. Rita's that Christian can be here as well. Next. The first time I had a run through was 35 minutes. Last night, clocked at 1 hour and 5 minutes. So I'll try to have speed reading. I have this on video. Perhaps we'll have it on YouTube. I don't know if anybody wants to watch this again, if you want to rewind it and see what I said, because I am talking pretty fast and trying to get it under. Trying to compress 60 years of information, personal information, and optometric care is pretty compelling to do that in 1 hour or less, but I'm going to try my best. Because as an optometrist graduating 1985, I am the main spark to help the Volunteer Optometric Service to Humanity in Ohio to collect used eyeglasses. We have a collection site center in Pandora where glasses are dropped off, used eyeglasses, and sorted. Number 4 million was dropped off 2 years ago to have prepared for our overseas teams. 1992, I was watching cataract surgery. I got some continuing education hours with Dr. Pica, just whichever direction that is, I think that way. We'll talk about directionality in a bit, but between patients, I said, Dr. Pica, I'm leading a team to Nicaragua Thanksgiving week. He said, can I go? I said, certainly you can go. He and his brother went. That was his first. He's been on over 55 cataract missions since then. Also, 14 years, 1 day a month, I was a consulting optometrist. They didn't know I was a behavioral optometrist, helping those inmates 1 day a month for 14 years. I didn't know until later I had a reputation. I was helping a lot of those inmates to have the reputation to help wean them off their behavioral meds and psychiatric meds with all things simple lenses. We'll find out during this conversation that 98% were younger than 30 years old. We'll find out I didn't know until later, why was I struggling taking tests? Why did I only have a 1.96 grade point average, even though I was at the College of Optometry at The Ohio State University? We'll find out eventually I was 16 years younger than 40 years old to qualify for bifocals, even at that time, even now. But behavioral, functional, neurological optometry is rarely consulted during the therapeutic care and rehabilitation for those who have suffered an adverse life-changing event. As with those who are post-CVA, there are some similarities with those who are post-concussion from motor vehicle accidents, sports, other head bumps at any age, even in the realm of autism and attention deficits, juvenile delinquency, the untapped area of vision and vision care in those populations. Next. The post-event individual has had an adverse reset in their life. They struggle with multifaceted sequelae. They can no longer tolerate the public arena or their own home in the same way they did prior to their accidents. They have innumerable lingering effects, including resets of their vision and their visual performance. But what is vision and visual performance? Because what we're going to be maybe doing, maybe one person might learn something that they've never heard before in their life today with my conversation. But we may well be unraveling some preconceived notions and looking at archaic notions of vision. Because we're going to be talking about some little-known aspects of vision and the functional performance of the two-eyed individual. We're going to be talking about some little-known optometric rehabilitative care that is relatively unknown in medicine, neurology, nursing, optometry, occupational therapy, physical therapy, psychiatry, and psychology. But how do we define vision? What do you already know about vision? As in the numbers 20/20, the eye test, the Snellen acuity, the 20/20 or the other numbers are a notation that denotes the legal standards for blindness, for driving standards, for monitoring levels of progression or deterioration of eye disease. It was standardized in 1892 by Dutch ophthalmologist Herman Snellen. How many of you have heard the actually archaic notion that 20/20 vision is normal or perfect? The earliest reference that I know of somebody that cheated the eye test, this guy a couple years ago wanted to get into West Point Military Academy. He had to pass the eye test to get in. He had a lazy eye. The guy, when he covered up his better seeing eye, he peeked, he looked through the crack to see with his better seeing eye, he looked through the crack of his fingers to pass the eye test at the time. He got into West Point, graduated number 21 out of 39, and then he became a general for the North and one of our presidents. Ulysses Grant cheated with the same eye test in 1839 that our school nurses and many other professionals offer our school children in 2024. The eye test hasn't changed. Maybe the visual demands in 2024 are no greater than they were in 1839. I beg to differ. But this is the same eye test that school nurses offer. The school nurse at Lima Christian Academy raised her hand after my presentation. A couple years ago, she identified that she was the school nurse, how she was trained and educated by the Ohio Department of Health to be a school nurse in Ohio. Stand the kids on the line 20 feet from the chart, record what you see with the right eye, record what you see with the... Oh, who caught that one? Are you awake? Thank you very much. Right eye only a distance, left eye only a distance, then check hearing. She raised her hand before she was certified and asked the head nurse from the Ohio Department of Health, why not do any vision screening for these school kids at near? The reply was, school children do not have visual problems at near. That's cast in stone, and we'll be seeing later in our conversation about near vision. For those individuals who you might know who are actually younger than 40 years old, and Jody, anyway, you mentioned that somebody had a stroke at age 26. But it is possible for people who have 20/20 acuity to have undetected visual deficits with their vision and their visual performance. So Snellen acuity does not describe the effort the individual puts out to see, the levels of comfort or their sustainability required in the visual task that they're doing. Is 2020 acuity really normal and perfect? How many experienced the calendar year 2020? I did. Did I say anything about my cataract care in 2020? Not yet. 3.5 months later, I'm the only one that I know of all the patients that I saw, that had a detaching retina 3.5 months later. I was eventually 3 millimeters at surgery July 1st, 2020, when the event started for me. June 19th, I had divine intervention. Thank you, Jesus, once again. 3 millimeters. The detachment was ready to pull off my macula. The detachment was repaired. The 5 breaks in the periphery, lasering all the way around 100 or 360 degrees. My lattice degeneration, when those of us who are highly myopic, highly nearsighted, our eye lengths are longer than average, the retina stretched, I have lattice degeneration that we don't see that often. But I did. My brother, a year and a half later, did also, but I had to find 5 doctors because the first 4, 2 on one Saturday, 2 on another Saturday, asked me privately where that was. Somewhere down south and a little east of here. They were ignoring what I was saying. The defect started up here for me in the upper right visual field, nose side, in a straight line. It's inferior retina on my ear side. I told them where to look. They looked at my business card because I said, please send a report to Dr. Pica, who did my cataract surgery. Please send a report to me. They looked at my picture, thought I was a clown, and didn't want to send anything to me. Never have yet. 2 on one Saturday, 2 on the following Saturday. Had I followed the medical advice that I was given, I would have gone completely black. And my colleagues, I am, with all due respects, I am not. As an optometrist, I am not an eye doctor. Most of the patients that I see come in wearing 2 eyeballs. Even though we're educated to assume everybody sees 1, I assume everybody sees double. When my fluid, the vitreous, was taken out, I was looking through a frosty right eye. The whole vision after that retina surgery was completely frosty, completely clear in the left eye. Most professionals would have the idea a person with 1 eye is going to do fine in life. Or at the time, Dr. Groman, you're 63 years old, time for you to retire. I don't want to retire until age 100. What did I do? 3.5 months for that blurred vision in my right eye to dissipate. My balance was off. My use of the English language and communication was compromised, and I was still seeing patients during that time also. Are you listening? We need, for those of us who are given 2 eyes, we need that depth perception. We need that to balance right eye, left eye. We need that for performance as an individual. But going back to 20/20 acuity, I've seen people from time to time who have 20/20 acuity and do not see the big picture in front of them. So 20/20 acuity, 20/20 vision is not necessarily normal and perfect. But we got to look at the basics. I have the $2 bill. I've never seen a counterfeit $20 bill. They won't show. I've asked at the bank in Pandora, can I see one, please? No, nope, can't see any. What do those individuals at the bank do to look for counterfeit except for that pen? They study the original proper $20 bill and go from there. So what we're going to continue to do is look at the basics of the human eye, even since 5th grade. Do you remember 5th grade science, the bottom half of one page, maybe the bottom quarter of the one page about the human eye? Even through high school and most presentations of the human eye, they show these parts. I don't know how to use this pointer, but anyway. You know where the cornea is, you know where the iris is, the pupil, you know where the aqueous and the vitreous, the fluid, the retina, the optic nerve, the lens and other parts, arteries and veins and all that. You might even learn about the extraocular muscles, the intraocular muscles, 8 muscles in total. 4 recti, 2 obliques that move the eyeball around. 2 internal muscles in the iris, the sphincter and the dilator. So that when you shine the light in the eye, the pupil gets smaller. Take the light away, the pupil gets bigger, but there's also a pupillary response to focusing and accommodation as well. But what is missing? If I would ask people what's missing, and I do that routinely in my office, they have a difficult time finding what is actually missing when we learn about the human eye. And if I would ask another professional, because it's not forefront in their thought of thinking about, and I will ask maybe some other professionals, do humans have 2 eyes? Well, yeah. But not everybody who has 2 eyes see one. You have 2 eye channels, which convey the information into and out from the brain, into the visual seen realm. But the 2 eyeballs are the only movable parts of the brain, normally. So this picture in the bottom left shows individuals very well, because there's a lot of double vision in the real world that nobody's asking for, nobody's looking for. The child might see this way and still pass the vision screening, because when you cover up one eye, half of that picture disappears in the other. 4th grade boy starting to hit the ball in baseball. Extra base hits and home runs. His dad finally said, "Son, why are you so efficient now hitting the ball? You've been striking out before. Why? What's the difference?" "Well, Dad, ever since I got these glasses from Dr. Groman, I only see 1 ball now." "Well, you mean you saw 2 before?" "Well, yeah, Dad, I always saw 2. "Well, why didn't you tell me?" "Well, Dad, you never asked me. If you would have asked me, I would have told you." But that boy knew that's normal, perfect, because he was told by the school nurses and other professionals, you have normal and perfect vision. So he knew that was normal to see 2 baseballs and have a difficult time trying to hit the ball. There's a lot of double vision out in the real world. But vision is brain. We have the 2 eyeball channels. We got the crossover at the chiasm. 80% stay on the right side. So this is my right eye, this is my left eye. At the right eye, right optic nerve. At the chiasm, 80% stay on the same side and go through the right visual pathway to the occipital lobe. I said 80%. I did say, well, the other 20% crosses over at the chiasm to go to the left visual cortex. Left eye, left optic nerve. 80% stay on the same side, left side, and then 20% cross to the right optic radiations. But vision is not only one direction from the world into the eyes back to the brain, but we have simultaneously, instantaneously, input and output at the same time. But this is a conundrum. Those individuals who have had that event have adverse resets, including vision and functional visual performance. Early on, I mentioned that functional vision care, functional optometry, neurological optometrists are rarely consulted in the rehabilitative care of the post-CVA patient, because it's based on, quite often, normal visual acuities. Vision and the visual performance of the two eyes are unfortunately assumed to be normal. And going back to vision's private, we can't crawl into somebody else's head to look through their eyeballs and see what they really see. And it's hard for the individual to express what they're seeing to somebody else. But vision, with all due respects, and visual performance is the least understood, least probed, least treated, least rehabilitated physiological and neurological function of the human body. But vision and vision rehabilitative care should be considered in the attention to these individuals. What is the earliest literature reference linking vision and behavior? 940 BC or so. Solomon didn't say this in English, but where there is no vision, the people run wild. King James says, Proverbs 29:18, where there is no vision, the people perish. New Living says they run wild. If you merge the two, where there is no vision, the people run wild. Normal people, this is the earliest reference. I like to look at original documents, literature. If somebody knows something earlier, please let me know. As a historian, I want to be accurate in what I present. But for normal people, if they have blurred vision, not clear, if they have double vision, not single, if they have vision with effort, not effortless, normal people are going to have difficulty sitting still. They're going to be frustrated, shorter temperament, they're going to be angrier, they're going to have difficulty reading, losing their place, skipping, rereading words, skipping, rereading the same line of text, avoiding near work, computer work, difficulty attending, comprehending, their cognitive skills are off. These are lingering effects that don't resolve immediately. Sort of like if you remember the old camera flashes of the past, the camera flash would go off. The flash wasn't there anymore, but if you blink, 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 you could bring it back. That's an after image. These are similar to the after effects that these people have with their adverse resets. But they are oftentimes photosensitive to electronic devices. They're sensitive to sunlight. They are sensitive to oncoming headlights. I was. But they are also adversely affected by flicker. Artificial lighting has 60 hertz. I can't even make my hand go that fast. How many caught when I used my medical grade pen light to show pupil responses? How many saw the flicker? I'm not pushing it. I mean, I'm pushing it on. Here, I'll get another one. They flicker. Flicker can trigger adverse reactions to a number of individuals, even ceiling fans, even Christmas lights with a flicker, flashing emergency lights. But you know the sequela post-event. Headaches, migraine, pain, depression, fatigue, insomnia, frustration, being overwhelmed, dizzy, off balance, sensitivity to noise, anxiety, nausea, irritable, short temperament. A lot of times, people are told for whatever diagnosis, this is your new normal, just live with it. But my approach is, let's try this, let's try that. Oftentimes, visual deficits and related sequelae can be rehabilitated toward normal function and performance if you try something, because where there is good vision, the individual is more efficient and productive. Where there is good vision, the people sit still. What are the visual defects that are not found with CT and other imaging? Refractive and refractive status, myopia, hyperopia, emmetropia. We're educated that the perfect human being doesn't need glasses. That's called emmetropia, not hyperopia, not farsighted, not myopic, nearsighted, but emmetropic. That's a perfect individual, doesn't need glasses. I started to think after I had my degree eventually from Ohio State University College of Optometry, they even, in the centennial year 2014, they even had, 175 notable graduates, notable alumni, and thank you, Jesus, they chose me as one of them. But the perfect human being doesn't need glasses, or whatever, vice versa. That'd be great if we lived in a perfect world. We're in a hostile world, but I talked about myopia and hyperopia and emmetropia and astigmatism a little bit. I forgot to bring a spoon. Anybody have a spoon? Anyway, the best way to describe astigmatism is looking at the back of a spoon, the funhouse mirror. We could have that mirror vertical, 90 degrees. We could have it horizontal. We could have it oblique. Look at that reflection of the funhouse mirror, the back of the spoon. That's similar to what people are looking through with their astigmatic lenses. But refraction is becoming more and more of a lost art. I guess I do have it not upside down. My colleagues are going towards the computer automated refractors. I had an uncomfortable conversation. I don't know what it's like to be Daniel in the lion's den, but I know what it's like to be Darrell in the lion's den. I had a conversation with a retired Air Force general. He had previously been the director of the International Space Station and the Space Shuttle, say that 10 times real fast, system in the United States. He did not like the information that I had to offer. Those individuals who we want to thank, those who served in the military, but when they go to basic training, when I talked to this retired Air Force general, he didn't like this information. What happens in basic training? What are they doing? They have to run in place, hike 50 miles with a 75-pound backpack, then do 200 push-ups, then look into the computer box, the outer refractor, look at the hot air balloon. The technician pushes some buttons, right eye, 1, 2, 3, 4, 5. Another button, average of all of that. Left eye, same thing. Tape comes out, those are the glasses that you wear. He didn't like that information, that those lenses are prescribed under stress. And then they have to wear them to drive a tank and shoot a gun. But presbyopia, that Latin term that I really don't like that word anyway, even though I love Latin. Presbyopia actually means old age vision. We were educated before I graduated in 1985 that near lenses are based on age. If you ask any of my colleagues, maybe you better not because you might not have a pleasant answer, but what does a 50-year-old need as a bifocal? They'll say a +2 right away. You always start age 40, +1 every 2.5, 3 years, add another quarter, +1, +1.25, +2. I had a friend that just retired last year in Cleveland. A few of us think outside of the box, a few of us think outside of the book. He had an irate phone call. Dr. Cherney, I have one of your patients here. He brought your prescription for me to fill. You prescribed bifocals for him. He's only 39 years old. It was free money going into that practice. We pay wholesale. I don't know if you know that, and then charge retail. Everybody does that. 5th grade boy struggling in school, at home, educated at home, His mom brought him over to me, and I prescribed glasses, and I also mentioned, we'll talk about later about his what convergence insufficiency is. We'll talk about that in a little bit. But I found convergence insufficiency. I said, let's do some vision therapy. Let's get both eyes to point in one place. She went to her family friend. Her and her husband had a friend who's an optometrist. She wouldn't even tell me later who he was, but anyway. She wanted to talk about the positive interaction that she had with one of his colleagues in Pandora, Ohio. He helped my son. He hated to read. He prescribed glasses for him. He found the convergence insufficiency. We're going to work on that because we're educated actually with convergence insufficiency. Tell the patient, tell the parents, don't worry about it. He or she's going to outgrow it. They don't have time to outgrow it in our world today. He prescribed, when she mentioned to the optometrist sitting in the chair, she went for her contact lens evaluation. Dr. Groman in Pandora, Ohio prescribed bifocals for my 5th grade son, and he loves them. Without hesitation, the doctor said, that's quackery. She realized quickly that this conversation was not turning all that positive. She actually said, for herself, she's having difficulty with her contacts at the computer to read. Could he please refit her with soft bifocal contact lenses? Without hesitation, he said, you have to wait another 8 years. That was just last November, a year ago, 2 Novembers ago. She came in and mentioned that and about her son a week later. I asked the compelling questions. Sometimes I get in trouble. I asked her when she told me the information he was not going to fit her with soft bifocal contact lenses, are you 32 years old? She said, yes, Dr. Groman. What are the visual deficits that are not found in imaging? The ocular motor control, neurological motor, monocular, one eye at a time, right eye only, left eye only, both eyes. When you look through binoculars, you're using 2 eyes, each eye and both eyes. What is their pursuit, their tracking? Does it wiggle? If it wiggles, those are the individuals that are going to skip over the 1, 2, and 3 letter words, the, and was. Do they have a precise jump from the end of one line to the beginning of the next lower? Do they have an accurate saccade? Or, invariably, are they going to redirect the 2 eyes and reread the same line or skip a line altogether? With both eyes, what about their convergence? When you're driving in your car on the superhighway, you're looking straight ahead. Your eyes should be parallel like railroad tracks. As you get closer and closer and closer to objects of regard, the eyes should turn in. And not everybody can keep both eyes pointing to the same place. If an eyeball drifts out, they have double vision. Thank you, Jesus, you didn't give us 3 eyeballs or 16 or 27 of them, but that's another story. Or they could be suppressing, or they could have long hair bangs to cover up the eye that drifts out. Or they could be suppressing that eye, or they could be leaning on one hand and pushing that eye closed. Stereopsis, 3-dimensional discernment, seeing in 3D. That's sensory, but other aspects, visual thinking, visual processing, visually predicting, visual memory. Visually predict going from here to your house, and you need to stop by to get a gallon of milk or something like that. Which way do you go? Right, left, which streets? North, south, east, and west. Visual sequencing, what is going on in that order? Do you have to do one thing at a time and come back and do the next and the next? Reaction time. How is that individual reacting? Because these individuals with resets, it can take a little bit longer time to do something. Even having a picture in your mind. When they take pictures, track eye movements, when you look at a random picture, they are random all over the place. And that's where you start to grab out some of the 1,000 words, because a picture is worth 1,000 words. But they might not be the same words in the text that you're reading. If you have a picture in your mind to give you some context of what you're trying to read, whether you're looking at the picture right beside what you're reading or you have your own in your head. Visual field loss, we'll talk a little bit about blind areas, scotomas, quadrant heminopsias, cataracts, blurry vision, debilitating glare, dry eye syndrome. We're talking about pre-existing conditions. There are people that I see even recently that had LASIK surgery 15 years before their event. They might have monovision. The dominant eye for distance, the near eye for near, that throws off depth perception. I don't know if you've ever driven out in the country, stop at the stop sign, turn right, look at the oncoming traffic to the right, look at the oncoming traffic to the left. One eye's blurrier because that's the near eye. They have to turn their body all the way over to find and try to figure out how fast is that approaching vehicle coming on the right, on the left. Am I safe to drive out? But even with LASIK and other conditions, very common for people to have dry eye syndrome. They might have dry eyes and watery eyes at the same time. What does everybody always hear from 99% of my colleagues? Drops, 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 drops. The front surface of the eye, the cornea, and the conjunctiva is, with all due respects, more similar to car paint. How good is it to spray water on dry car paint? Just temporarily. That's the same thing when we put drops, 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 but we also have the eyelids that work like a squeegee from the ear side to force the old tears down into the drain, and half of that new drop was put in. When you get drops, even antibiotics or whatever, before and after cataract surgery, glaucoma drops. How many have heard that when you put the liquid drops in, you close the eyes and you plug the drain? Who's heard that this is the nasolacrimal duct? In Pandora, the tears go into the nose. It's not the nose stuff typically going into the tears. It should be the lacrymonasal duct. But what's actually better than drops, drops, drops? Perhaps ointments. In the same counter, just right beside the drops, there's gel, there's ointments. Lacrolube, Paralube, Refresh PM, sort of like, it is the same thing as waxing the cornea. You want to do that before sleep, not before driving a car, watching TV, or reading a book, but sleeping. Put that ointment in the pocket of the lower eyelid and roll the eyes up, down, left, and right. Every night for 1 month, every other night on the second month, one night a week on the third month. Most people don't get through the 3-month protocol because they're happy. They come back years later, Dr. Groman, I still have the same tube that I had originally. I don't have those symptoms anymore. But what is actually key are the therapeutic ophthalmic lenses. I'll try to say that 10 times real fast. Is a significant key. The best and careful refraction, it's becoming wherever it went, it's becoming lost art, with all due respects. Maybe even to consider that the near lens might be different in need than the far away lens. I have a patient that I'm offering care to right now, post-concussion from a motor vehicle accident. She's having eye movement skill rehabilitation care before seeing me. And she's having a tough time. I said, you're wearing your progressive lenses. You're following that target. Must have left it back there. Anyway, you're following that target, and you're looking through the top part of your lens, the far lens, and you're trying to look at near through that far lens. You're looking through the channel of the progressive lens. You're looking through the astigmatic funhouse lens. Having a difficult time. She says, I need to take my glasses off for a while. I need to close my eyes, and compounded with the lighting in that clinic and the overhead lighting, the reflections of that same lighting from the mirrors, having a real difficult time when I prescribed single vision lenses for that 6 inch to 24 inches. And she was starting to follow target. She said, that feels a lot better. Even micro lenses can be significant. An ounce of prevention is and can be much better than a pound of cure. One fellow brought in his computer glasses. Dr. Groman, I got these computer glasses online, Gunner Optics. Bring them in. He paid a certain amount for zero lens power. In Latin, plano is zero lens power. I said, I can match the tint. I can match the anti-reflection coating. He paid a basic price for a zero lens. If he had a prescription, would pay a little bit more. Bifocals would be a little bit more. I said, these are not zeros. They are plus a quarter. Not every lens makes the world clear, so you might even do in the privacy of your own home to do a scientific experiment. Take your glasses off, put them on, off and on. Look at the blur with the glasses off, put them on. Makes it clear, but is it clear and bigger or is it clear and smaller? Is it clear and closer? Is it clear and farther away? Whoops. Sorry. But do not ignore the lesser seeing eye. I've seen individuals that have had a blind eye for 36 years. Hand motion in the right eye, seeing well with the left. Age 6, neighbor boy threw a rock, hit her in the eye. Age 7, age 8, this is your new normal, just live with it. Age 10, this is what you've had since age 6. Age 12, age 15, just live with it. Age 20, age 22, age 28, age 30, age 32, age 35. She came to see me at age 36. She said everybody that had seen her before says, your right eye is interesting, and only took care of the left. I brought up the microscope. I said at age 6, did you know that you had cataract surgery? They did not put an artificial lens back in place. Plus 12 lens, she had 20/40 acuity. I prescribed some contact lenses, special order. Dispensed the contacts to her, called her up the next day. What was it like to have a much clearer vision in your right eye that you haven't had for 30 years with the left? She said, I felt relaxed. But a lot of times, and I've even seen individuals that came in to see me double vision for 35 years, falling off of a motorcycle in 1982. She was not allowed the privilege to drive or to work because of her double vision. She saw my colleagues just keep wearing that patch. Where else can I go? Come back next year, maybe we'll have another idea. She did that for just under 35 years before seeing me. I put prism right eye, prism left eye. With both eyes open, how many of me do you see? Look at your husband. How many of your husband do you see? One. With both eyes open. Dr. Groman, it only took you an hour and a half. We're always given a 12-minute visit or less every year and a half. Why couldn't we had a longer visit one time? And I apologized to them on behalf of my profession. And I mentioned, to God be the glory, he gave us 2 eyeballs, not 3 or 15 or 27. Then it'd be really hard to point them all in one place. And then my optometry dean didn't like to hear what I said to them and to mention in her office, I'm reporting from the front lines. With all due respects, auto mechanics do a better job at aligning tires than some of my colleagues do to align the 2 eyes. Ooh. Can we balance the lenses, right lens, left lens, equal power, same power? Can we reduce, eliminate completely the lens for astigmatism, that funhouse lens? Thursday, one came in, she was 8 days post-event from something that went on in the ponds. She has double vision off to the left with her glasses, had monovision and contact lenses, had cataract care 20 years before, maybe more. One eye for distance, one eye for near, but she figured out that she was more comfortable having glasses to get her balanced. 4 steps of astigmatism right eye, 5 in the left, somewhat close to 180 degrees horizontal. I took the lenses for astigmatism completely away. My son says, "Dad, don't tell people that you are a radical optometrist." I said, "I'm going to do something radical here. I don't want to plant seeds of doubt. I'll tell you in a moment what I'm doing." Minus 0.75, no astigmatism, sphere in the right, plus 0.75 in the left. Put them in the trial lenses, trial frame. She said, "This is comfortable." I said, "Does it feel like that you're not white-knuckled anymore?" "Yes." Looking off to the left, I don't have that double vision. "Let's order the lenses." She put her previous glasses on. Yuck. She didn't say that word, but that's basically what she said. Can you line up? If I do prescribe astigmatism, and I do from time to time under duress, but I try, if we can, 90 degrees if it's vertical, 180 degrees, not 95, 105, not 5, not 160, sort of like this. Tints can be very helpful because of that debilitating glare. Photochromatic, photo-changing transitions get dark and light. Maybe solid tints, maybe the old Corning filter lenses, maybe the orange reddish orange, maybe the all orange, maybe the yellow is a big calming factor. Anti-reflection coatings for the blue light. Anti-glare. Let's talk a little bit about double vision. This is the fellow's driving glasses, binasal occlusion. I first learned about 25 years ago about binasal occlusion. John Streff and his son Dean, both optometrists, would go to Drake Rehabilitation Hospital in Cincinnati one day a month. Walking down the hallway one time, found a fellow sitting on a chair lamenting. Stopped, asked, "What's going on?" He, at the time, was a pediatric oncologist. He said he had a brain tumor that was removed. It was okay to remove the brain tumor, but he had constant double vision. "I'm going to have to retire. I don't want to, but I can't handle practice in life with the double vision." Dr. Streff went to the nurse's station, got some Scotch tape, put it on in a V pattern on his glasses. He put them on, looked down the hallway one way, looked down the hallway the other way. No double vision. So sometimes we might use Scotch tape, sometimes we might use duct tape, like this fellow really loves. Sometimes we use electrical tape, sometimes we go with school colors, scarlet and gray, or green and gold, or something like that. But prisms are becoming a lost art. Oh, it's my time. Okay, all right, because... 20 minutes. Oh, woo. Got to clean up this water that I made a mess. Sorry, I apologize. Prisms. It's becoming, with all due respects, a lost art of prescribing prism. The guy on the right side, he has Fresnel's 20 base out. He had a brainstem aneurysm shipped over from Fort Wayne. His family are patients of mine. Kids had some vision therapy with me. In a rehab clinic, I forget the name of it, in Chicago, his wife called and said what happened to her husband. "Dr. Groman, I want to schedule my husband to come see you." He would not have been allowed to leave that rehab center anyway and go back. But I said, "No. Don't have him come over to see me. I have some colleagues, Debbie Zielinski, who knows a lot more about brain than I do. I'm still practicing. I'm still learning. I'm really worried about some of these questions I might have that I might not have the answer. Oh boy, we'll find out." And I mentioned some other neurological rehabilitative optometrists in the Chicago area, but I didn't mention the one individual who came into his rehab room. He's having a terrible time in the hospital bed. Mike Zost, as he was talking to the patient and the family in the room, his wife and family eventually said, it was just like Dr. Zost was saying exactly what you'd be saying, Dr. Groman. Put on the Fresnel 20 base outs. He put those on these plastic glasses. They were actually planos just to put some prism on. He put them on, got up and out of the bed, and walked down the hallway, turned around, and came back. He is out of Chicago, the rehab. He's having vision therapy with me 1 hour once a week. We're backing down to, he has 16 base outs, 8 out, 8 out. You add the outs out, 8 plus 8, lower math, higher math, 16. 1 base up, 1 base down. I'm changing the lens prescription with vision therapy, wearing yoke prisms, going back and forth between the mirrors, base downs, base ups, base rights, base lefts, maybe compensatory. We'll talk maybe briefly about that, but yoked prisms. But prism has thick part on one edge and a thin part on the other. Base down, base up, base right, base left. The ER doctor from Bluffton Hospital called me at about, 10 till 5 on a Tuesday. He had a patient that was there, sudden onset of diplopia that morning. Should he see ophthalmology or go see you, Dr. Groman? I thought, he's not going to be able to see ophthalmology tonight. He's under a lot of stress with the double vision. He came over to my office. Not too many providers have, and we'll see later the picture, the VTE lenses that you can put the lenses in the goggles and rotate them around. I actually came up with, and if you want to see this later, 8 base up in the left eye, left lens, 3 out. I said, he put them on. He said, oh, I don't have the double vision anymore. When you have an event like this, you're really anxious what's going on in the life with this life-changing event. I said, wear them home tonight and come tomorrow. I can see you right away at 9:30. Some of these double vision events, we don't know if it's going to be lingering, if it's going to be long-lasting, is it going to resolve quickly? When I walked in the exam room, he's sitting in the chair. He didn't have the goggles on. He said, I hate them. Maybe he didn't say that exact word, but he said, I don't like them. He said, I don't have the doubling. He still had a little bit off to the left yet, but wasn't as severe as it was the night before. Just to have lenses to send home, prisms to send home with him for overnight to help him calm down. Finding out, and a lot of times when I see patients one time and maybe a follow-up after a week or two, they never come back. And I found out from third hand, my staff said they know somebody that knows somebody that knows him. He says he doesn't have those symptoms anymore at age 62. We'll talk about the lady here when I flip the page, but she has yoke prisms in her lens. So right side, base out, base out. So the right lens, base out in the right lens, base in towards the nose with the left lens yoked right because of her right hemianopsia that opens up her visual defect off to the right a little bit, but compensatory prism, up and down, or in and in, or out and out. Horizontal, vertical, maybe vertical and horizontals. Come see the 8 up in the left and 3 out in the right. Yoked prisms for sector hemioptic defects, right visual loss, yoked right, left field loss, yoked left more often than not, the thick part on that side, or even yoke lenses in rehabilitative care, base downs. If you want to wear 10 down right, 10 down left, a lot of my colleagues would say that eliminates each other. No, there are some significant optical effects with 10 base down, it shifts up the visual world up, shifts the center of gravity of the body back on the heels, base ups, shifts the visual world forward onto their toes, base rights, shifts the visual world left, they shift their center of gravity to their left foot, base left, each lens right and left, shifts the visual world to the right. And can be significant with that care to help the individual to be much more balanced and moving along more dexterous and have better dexterity. And so we talked a little bit about the trial lens refraction, the guy in the upper right, trial lenses, taking the time to see would 3 help, would 4 help, would 8 help. Trying back and forth, let's try this, let's try that. Maybe let's not go a whole lot, but let's see what might happen. And these are the rotating prisms. There's kid size, I did bring an adult size of different lens powers, 1s up to 15s here in my set. But optometric rehabilitative care, the key in facilitating the reset and the rehabilitation of the individual. Neurological, ocular, motor, and visual sensory rehabilitation, maybe once weekly for 1 hour, once a week in the rehab and vision therapy room. For optimal rehabilitation of eye movement skills, the individual should be, if at all possible, wearing the best lenses for that distance. And if you see those beads, I must have left them there I did. Anyway, it's a metal rod with a silver ball bearing or somewhat gold ball bearing. We'll talk about Dr. Wolf, who designed the Wolf ones to work with convergence and pursuits and saccades and one eye at a time, both eyes at a time. The history of vision therapy that maybe some people do not know about, maybe this helps some of you to learn a little bit more about some of us who offer this care, but it is time-honored, it is well-documented, it is an efficacious treatment modality. Vision therapy can be traced back formally to the optometric extension program established in 1928. The OEP is the first professional organization, and if anybody knows anything earlier than 1928, please let me know, because I'm a historian and I want to be accurate and recognize other professions that have the requirement, even for today, continuing education hours to renew your state licenses. Optometry started it in 1928. Physicians, once they graduated, they didn't have to do any more formal education. 1988 was the first year in Ohio that dentists, from what I have as information in the past, 1988 was the first time dentists in Ohio were required to turn in continuing education hours to renew their licenses. Real estate agents, barbers, hairstylists, everybody has to have some continuing education to keep their licenses going. And optometry preceded all other professions and the state licensing boards. But the other optometric organizations, 1970, the College of Optometrists and Vision Development, the Neuro-Optometric Rehabilitation Association, but one of my mentors, along with Dr. Streff, Bruce Wolf. How many know that during the Big Red Machine, they had a team optometrist? the batter always hits the ball where you're looking at it. You look at the bottom of the ball, you hit the bottom of the ball, you get pop-ups, if you look at the top of the ball, you hit the top of the ball, you get grounders, if you look at the right side of the ball, you hit the right side of the ball, goes to left field, if you look at the left side of the ball, you hit the left side of the ball, goes to right field. There is a better place to look. How many of you have seen a horse? Can you lead a horse to water and say, horse drink water, horse drink water? Same thing with human beings. You cannot necessarily tell them what to do because they may or may likely not do it. But there are ways that few batters have the idea of where to look, and when you look where you're supposed to look, you're going to see something that not many batters see. And I'm not going to tell you today. There are ways to visually slow down the approaching ball and visually make it bigger. Your batting averages go up when you try to hit one ball, not two balls. When you try to hit a slower ball, not a faster ball. When you try to hit a bigger ball, not a smaller ball. I think it was Jimmy Connors, or I'm not sure who it was, McEnroe, ended his tennis career, Wimbledon. I can't find it. I looked online. If somebody can find it, let me know. That whole entire series at Wimbledon, when he retired, he said that was the best he'd ever played. It was as if he was hitting a basketball the whole time. It's a lot easier to hit a basketball with a tennis racket than to hit a tennis ball with a tennis racket. Growing up in the 1960s, I heard when baseball players struggled and whiffed the ball, they would actually say, he was like, I was trying to hit an aspirin. It's a lot harder to hit an aspirin with a baseball bat than to hit a baseball with a baseball bat. Mm-hmm. But Dr. Wolf worked with a number of those players. You've not heard because you've not publicly mentioned the guy that grew up in Cincinnati. Marge Schott, the owner, said Dr. Wolf worked with this guy. He was in Dr. Wolf's office. Trying to break HIPAA laws and trying to go to jail, but PR has never said anything about the vision therapy that he had when he played for the Reds, the World Series in 1975 wins, 76, Montreal Expos, Philadelphia Phillies, back to the Reds again. You've not heard that? We really have to hunt to find an athlete who says anything about vision therapy. Larry Fitzgerald, if you look, his name, plus vision training, vision therapy, you'll find the articles that he's trying to get out in the general public to say that if he didn't have the vision therapy with his grandfather and his maternal aunt, he would likely not have finished school, and he may well not have been a wide receiver for the Arizona Cardinals. Look up Larry Fitzgerald. So vision therapy, with all due respects, preceded all the other therapies and helped jumpstart another. Preceded physical therapy, language and speech therapy. I know there's some occupational therapists here. I've had some interaction with the OT department at the University of Philly for, 10 to 15 years or so. Students come over and shout at me for an hour. I wish they could come and be with me for 2, 3, 5 hours or a week or 10. And they all know, you will know, you know your pioneer, Dr. Gene Ayers, up on the right side. How many know that Dr. Ayers was encouraged by functional optometrists like me, Jerry Gutman in California, and others to start up to have occupational therapy as a profession. Occupational therapy started as an out-branch of optometry unknown. So here's some references: The Ghost in My Brain. Clark Elliott, PhD in artificial intelligence, had what he thought was a mild whiplash. There's the reference there. How a concussion stole my life and how the new science of brain plasticity helped me to get it back. Ricky was written by her dad, a psychiatrist, about his daughter who in the 1960s had all sorts of institutional care and what do you call when you do the brain thing? Whatever is that, whatever. Lots of meds with optometric rehabilitation and vision therapy, and also some nutritional aspects, but the key was vision therapy helped her to change her life for her. I can't add this, I just found out from my optometry classmate, age 88. She started optometry when I did the first time around. She was 42, I was 22. She said, Darrell, a lot of these individuals would benefit to have classical music. This book here This is Your Brain on Music, and I have a list that I wasn't able to get in the document. From Bach and Barber and Beethoven and Chopin and Tchaikovsky and Vivaldi, Four Seasons, Winters. But that helps to reorganize, right? So thank you for your kind and undivided attention. If I was not an Eagle Scout, I would not be here today. That's how I learned to be perseverant, even though adults said, do not go back to Ohio State Optometry. They have this song. I want to go back to Ohio State, to old Columbus town, to the stadium to hear the band, by far the finest in the land. I want to go back to Ohio State, to old Columbus town. I want to go back. I got to go back to Ohio. I went back. But what did I do before going back to Ohio State? 3 years of optometry, 4 years of zoology, restart. First year optometry school, my optometric general optometry education at the College of Optometry. Year 1 in Chicago, nothing transferred from Ohio State Optometry. I had to start all over in Chicago at the private school. Before going there, after I was a taxi driver for 3 days, the low point of my life, I had to take another class in English, statistics, and psychology so I could go to Chicago. I realized I can't afford the private school there in Chicago. They wouldn't give me any advanced standing, lots of student debt. At that time, and still, as I continued, went back, I petitioned Ohio State University College of Optometry. The faculty vote was not unanimous. Must have been one more than half. I got my $1.96 back. Get your grades over 2.00 C average when you're back. I repeated the second year at Ohio State Optometry. I never looked at my grades when I went back the time in optometry school. The second time around, I would get called by the college secretary. Darrell, come over here. We have to come up with a special course number. You're taking the same course that you had before, but it can't be the same course number. It has to be a unique one because you're special. He did say you were a special case. I am, special needs, whatever. So I knew, I was still going. In the next academic quarter, come into my office. We've got to come up with some new numbers. The next academic quarter, I did that for 4 academic quarters. I knew it was still there, and then I got on track with everybody else, and there's this list to practice graduation, and hand out the optometry degrees on a Friday, drive to Chicago the next day, fly to London, end up in Tanzania, East Africa. Optometrists from Northern Ireland, Scotland, Wales, Denmark, Australia, Minnesota, New York, California, all merged to Tanzania to help those individuals at the end of dirt roads to see better. I've seen patients in Mexico, Guatemala, Honduras, El Salvador, Nicaragua, Venezuela, India Christmas Day, Ukraine 3 times. So thank you for your kind and undivided attention. I am in private solo practice in Pandora since 1985. If you had some questions, feel free to ask now. As I mentioned, I was the optometrist at Lima Oakwood Forensic Center, previously known as Lima State Hospital for the Permanent Insane, and the Volunteer Optometric Services to Humanity. Oops. Thank you for your welcome.